Okay, top 3 upper extremity conditions you don't want to leave untreated. First of all 3 things I'm going to mention are going to potentially masquerade as sprains. Times when you feel like you just tweaked your shoulder or tweaked your wrist, or maybe it hurts a little bit, you're gonna let it just get better on its own. I've seen many patients over the course of my career who come into me many months after the sprain, only to find out that you have a fracture or a complete tear or a fracture dislocation. So let me go through the list. So number 1, acute rotator cuff tears. Now, what is that? That's your rotator cuff that helps you elevate your arm. It hurts usually right over here if you injure it. But if you have an acute rotator cuff tear from an injury, whether it's a dirt bike, football, basketball, weekend warrior stuff, that is something that you really want to know about as soon as possible. The problem here is that if you have an acute tear and it's retracted, like I tell people, like it's like a garage door spring, boing, it pulls way away from the bone. That is something we can repair right away. If it's left untreated, maybe say for 4 to 6 months, that becomes increasingly harder to reattach. It starts to scar in, the muscle starts to get lazy, fibrotic, less elastic, and all of a sudden now it's going to be less likely that the tendon is going to be repairable. You'll end up potentially having a higher re-tear rate from a surgery. By the way, when your rotator cuff is torn like that, you're gonna have continued pain for a while. So that's really important to go see a doctor, get a careful evaluation, and I usually will MRI patients with acute shoulder injuries like that right away, rule out that tear, because you never know and you never wanna miss that. Okay, number 2, scaphoid fractures. Now, a lot of people who sprain their wrists probably never make it into my office. There are a subset of people who sprain their wrists who actually broke their scaphoid. The scaphoid is a small bean-shaped bone in the wrist, and it's a very important bone, and when it's broken, the problem is it doesn't have a great blood supply, and so it takes a lot of time to heal, and it requires immobilization right away. And so there are a lot of people who think they just tweaked their wrist and the pain maybe gets better but never quite goes away, and may come into me say 4 or 6 months after the wrist sprain, and we get an x-ray, and next thing you find out, oh, this was a break and it hasn't healed, and you've gone on to what's called a scaphoid non-union. That is a harder thing to treat than an acute scaphoid fracture that sometimes can be even just treated in a cast. A scaphoid non-union definitely needs surgery. It needs sometimes bone graft. It might need other types of reconstructive considerations. Even with surgery, sometimes has a harder time to heal. So really important, if you sprain your wrist and it's lasting more than a week or 2, come in, get an x-ray, get it checked out. You never want to miss a scaphoid fracture. And number 3, a finger sprain. Now, a lot of patients jam their fingers, whether it's playing basketball, if they fall, wrestling, whatever the situation might be. If you have a sprain of your finger, right in this finger joint here, this PIP joint, every so often I'll see patients who come in late where they have a fracture dislocation, where not only is it broken, but the joint is dislocated. And when that happens, that is something that when found early can be treated in a more limited, often surgical way, sometimes non-operatively, but sometimes surgically. But if I find it late, it's going to require a more complex, longer operation to reconstruct that joint, getting it closer to normal. So if you jam your finger and haven't reestablished all your motion within a week or 2, very important to come into my office, get it checked out, make sure nothing worse happened with respect to the joint, the bone, and, you know, worst case is the best case. You came in, wasted your time, and found out everything's normal. So, you know, I highly recommend, if anything's lingering early in the process, come in, get an x-ray, get it checked out, and, you know, the worst case is the best case, which is everything's fine and there's nothing to worry about. The best case is also sometimes the worst case, but it's also a good case because you found an injury that's severe early in the process. And so in order to treat a severe problem earlier, always better than finding it late. If you have any comments or questions about the content you just watched in this video, leave your questions below in the comments. We're here to help.